pain is debilitating sometimes. And if we have the opportunity to see if we can figure that out quickly, most of the time, by the time they make it to us, it's something they've been living with for weeks, months, some patients years.
I think that there's a better direct line to patient care in a smaller hospital. There's less filters, there's less barriers to care for those things that I want to get done. I can speak directly to the CEO or speak directly to a manager and have things happen, as opposed to when I worked in large university hospitals. There is levels of bureaucracy that slow that process down.
It draws a lot of people from the community that can be taken care of reasonably quickly without having to travel far. There are other pain clinics, but sometimes it can be a long hike and a long road for patients that may need 1, 2, 3, 4, 5 treatments of whatever it may be, if it's a chronic situation where they're dealing with it long term, and it's just nice to have it nearby.
Many of our patients have to have multiple treatments, and in doing so you become friends with them. And so you definitely have the boundary of patient-provider, but then again you also, hey, how's the family, how are things going?
Sometimes patients come to the pain clinic and they have issues that can be treated with injections. Sometimes those injections work really well. Sometimes they don't and they need some further treatment. In that scenario, the pain clinic will send me patients to see surgery as a consideration. Another scenario is where patients come to me and I see them and I think that maybe they don't need surgery, or maybe they don't need surgery right away, and maybe the best thing to do is to try injection therapy or other interventions that the pain clinic does.
If I have a patient that they're coming to see me for pain, but I know that I can't help them, I have the ability to reach out directly to him and say, hey, I think this person needs to be seen sooner rather than later. Can you help me out? And he always does. So that collaboration that I have with our neurosurgeon, it speeds up the process for our patients many times.
Not a day goes by in the office where I don't have at least 1 or 2 people tell me how great their experience has been at the Hillsdale Pain Clinic and how much better they feel. And I think people point to how informative both the Brians are, how they explain things, how they're sitting down talking to them. Brians are showing them x-rays and models, and so not only do they feel better after their injection, but they feel really well informed after their consultation as well.
The upside for pain management is a lot of patients we are able to treat the same day, and so there's a quick turnaround of improvement that you can see.
One of 2 things is going to happen. Somebody's going to have relief or they're not, and then we can always be more invasive. But if we start off being very invasive and doing some big surgery and somebody's not happy, then we haven't done the right thing.
We are not going to do anything without telling you first, without explaining it thoroughly, and then we're going to do our best to make sure that we do an excellent job of local anesthetic, because our patients are awake for our procedures in most cases, and they don't want to have a bad memory, and I don't want them to have a bad memory. I want them to tell 10 people about how good it was.
It's just one visit away. It can be a 20-minute conversation to where somebody says, I had no idea any of this was even an option or possible, or something that could be treated. I thought I just had to live with this the rest of my life.
I want you to know that we take great pride and care in making sure that when we're going to perform a procedure on you, you're going to have the best experience you possibly can.